Today, I'm honored to welcome Dr. Laniyi Ogunsanya to the show. Dr. Ogunsanya is a family medicine physician practicing here in Nova Scotia with a remarkable journey that spans Nigeria, the United Kingdom, and now Canada. He began his medical training at the University of Ibadan, completed postgraduate specialty training in family medicine in the UK, and later continued his professional journey in Canada, where he earned additional credentials in family medicine. Alongside his clinical work, he also serves in leadership roles in healthcare here in Nova Scotia. Above all, he's a husband and father and someone whose lived experience brings both depth and humanity to the conversations we're having today. You're watching Talk with Dr. Agnes show, and we'll be right back. So before we begin, I have to say something interesting about both of us.
Okay.
So number one, we went to the same medical school.
Yes.
And number two, we both moved to the UK.
Yes.
Number three, we completed our residency training to become family doctors, family physicians in the UK.
Yeah.
And four, we moved to Canada. So we actually share a similar journey or journeys, whatever. Yeah. Okay, so a quick question here. Tell me, what inspired you to pursue medicine in Nigeria?
Yes, thank you. Again, thank you for the privilege and the honor to come on your show. And I think it's a beautiful one. Mm-hmm. And hopefully we can inspire one person or the other.
Absolutely.
Why did I do medicine? You know, it's my mom. Mm-hmm. Really, my mom. You know, she retired as a matron, head nurse then in the UCH, and I loved the way she dresses and gets ready for work, and I just admired it. And then they always put on uniform. I'm like, wow, this is nice. And maybe she saw that fascination, and then she, the way moms will just project your dreams and allow you to be exposed to your desires. So she then brought me once or twice to our workplace, and I just loved the setting. And I just said, I want to be a doctor. I said, yeah, it's fine. And of course, from then it just stuck to me, and I didn't feel like doing anything else apart from that. At the point, I felt, well, we can always add one or two, commercial things to it, but the primary call was I was going to be a doctor, and I'm thankful that I had the privilege to pursue it, despite all the different challenges here and there.
Yes,
to get to the end goal. Yeah, and so here we are.
So for me, my dad, I think during the war, he used to tell me stories how I don't know what they call them. Maybe is it community support?
Community health
support worker that they train them up for to be given injections and wound care and what have you. So he used to tell me all the stories, and not knowing that he was inspiring me to become a doctor. Yeah. So my inspiration was my dad.
Yeah, that's. I mean, the impact of parents on the children, it's phenomenal.
Exactly. And so, what led you to move to the UK from Nigeria?
That's a story. So I was one thing that while I didn't know, we had a lecturer who takes us pediatrics then.
What was the name?
Dr. Asinobi.
Asinobi, yeah.
And she was always saying, you guys were preparing you for exports. You're preparing you for exports. So
little did we know.
Little did we know that she knew what she was saying. She must have seen something that these guys can't stay here. Mm-hmm. Because the quality of training she was putting into us, she knew that we would not be satisfied, if we stayed in the environment we were in. So by the time, she was sowing that seed. But what made me decide was one of these. So it was interesting. I had, because we're trying to, it was expensive. We will not live in Nigeria. So I had a small farm and I had workers interested. And so, because it was easy to do a farm and just breed, small fish and get their fingerlings and we'll send it to. So somebody ordered. So while we're struggling to get customers in the city we're in Ibadan, there was one guy, he just ordered 50,000 of that
Wow.
And he was going to pay us in the millions. I'm like, what does this guy do?
Exactly.
So I was interested in what what the guy does. So I took the trip to the capital city, it was Abuja then. And I met this guy. Interestingly, this guy couldn't even understand a sentence in English. And by the time I probed him a little bit further, I realized the guy was just like one of the people, we call them rank and file
Yeah.
in the army. I'm like, how did this guy get all this money? So I decided, no, I don't think I want to stay in this system. I mean, every system has its problems.
Of course, pros
I'm
and
like,
cons.
if we are trying to contribute our best and the environment, is not, because one of my friends is late now, who he had finished at that time, he wanted to do his house job. And because there were so many people struggling to come to the Premier Medical Center, so they had to take them as a supernumerary, which means that they'll work as house officers, but they won't get paid.
Wow.
But they wanted to do because they just wanted to leave. They just wanted to finish up and move on. They want to move. So I'm like, no, I think I've got it here.
Yeah.
I'm off. So that just sort of got it for me. And even when I wasn't planning for it, I started to make active plans. Yeah, I just said no. I have to, because I won't really get to my best if I stayed in this environment. Yeah, so I had to just find the easiest access to do my exams, doubled up on it, and here we are.
And here we are. And talking about adding on to that, we're in Canada. So
Yes.
what motivated the move from UK to Canada?
I mean, UK is interesting. I mean, I love UK. It's a lovely place to be. But you get to the point when you've done your best and you still want more. And right now, it's not about the money or the remuneration. It's more of, can you express yourself the way you want to express yourself? You've been trained. You're now a specialist in your own field. Can you now bring out your creativity? And I felt I was limited in the UK doing that. And then Nova Scotia came up. And I remember, I can't remember who came to the UK then, but one thing he was saying was that, look, we will allow you to express yourself. We will allow you to do what you want to do. We know you have more. We will allow you. And that sort of was, that was fascinating to me. And I was like, let's go get it, and here we are again.
Yeah.
It's not without its own challenges, but overall, I think.
What were some of the biggest personal and professional adjustments during your transition from Nigeria to the UK, from UK to Canada? Any personal or professional challenges?
Well, honestly, I'm grateful for the opportunity to have gone through everything I went through in Nigeria. Because it sort of builds resilience in you.
Exactly.
And so getting to the UK, it was bread and butter for me. All the things that people were complaining about, I didn't see it. Someone is trying to make me feel down. I'm like, what do you mean down? Where you coming? Come on, move on. Someone
do you know where you're coming from?
Yeah, that's why someone was making me feel I'm not their color. I'm like, come on, what's all that? You know yourself. It doesn't matter what anybody says about you. You go get it, and make yourself so valuable that no one cares. They just want you, and that's been the key. I mean, so UK to me was, he had his challenges looking back, but now I realize I actually had a lot of challenges, but I didn't see it because I was too focused on what I was driving at.
On your goals.
On my goals, and
your ambitions.
It didn't matter what was coming at me. So the same thing coming to Nova Scotia, I was like, the challenges they were interesting to me because my approach is, let's solve it.
Yeah.
I'm not going to run away from it. Let's solve it. And everyone is different. Some will like, okay, the challenges, I can't wait. And everyone has what they're most comfortable with. So I think the the greatest lesson I think I got that has helped me in Nova Scotia is appreciating the difficulties you face from your background, because it builds resilience in you. And whatever comes after that, just build on it.
Just build on it.
Yes. So that's me.
We've kind of talked about it, like you have this unique perspective to
Yeah.
have practiced medicine
Yes.
in more than one healthcare system.
Yeah.
So what are the strengths you see in the UK system, the strengths in Canada, and how can these two systems, like, learn from each other?
I think each system is unique.
Yeah.
It's cultural, and we have to appreciate that. So there's some similarity. There are a lot of similarities, but there are some
Universal
unique
healthcare
universal
system
healthcare
for
system, and there's some unique differences, right? I mean, the UK. Imagine the whole of Nova Scotia. We're just over 1 million people. England alone is over 40 million people, right? I guess, and writing prescriptions in the UK, I don't think too far before I write it. Here, I have to consider what my patient can afford.
Exactly.
Will the insurance be the drug plan? So we have to reason with the patient. And that's why I'm grateful that I'd worked in Nigeria for a while, because then we had to look at what can the patient also afford.
Exactly.
So it was a mixture of both here. So I think that's a beautiful combination to me, and I enjoy it. It can be challenging when you start, but as long as you can overcome the first hurdle, I think you'll be fine.
I remember this story that happened. So when I moved to Nova Scotia, let me just say I went to report myself to the pharmacist downstairs.
I did the same thing too.
And I said, just in case you saw any kind of wonky prescription or something, just call me.
I think the pharmacists have done a brilliant job too.
They are so.
I appreciate them, honestly. I find I just smile, because when they say this patient has this kind of prescriptions, why are you doing this? And I always call them to thank them.
Yeah.
Because I want to say thank you to all the pharmacists, basically. They've done brilliantly well. Sometimes we get on their nerves because they can knock on our doors multiple times and we won't answer. But I like their persistence, their resilience. They're trying to get a hold of us. And sometimes they get our patients to run after us. But I like that they protect us.
Exactly.
That's the way I see them. And
we're a team after all.
Yes,
We have a common goal.
Exactly. So sometimes I write some medication like, sorry, this is not available in Canada.
Yes. And I'll say, oopsie.
I'm like, okay.
The first thing was like, in the UK we had Canesten, HC.
Yes.
But here they don't. You
There's
have to.
nothing like that.
So he would not write, Dr. Wade, but maybe you meant to whatever.
Yes.
And he would put a smiley emoji. I was like, yes. So he's got my back. So whatever prescription or calculation.
Yes.
It was just different here. But I made myself, I went in, humbled myself, and I wanted to get to know the pharmacist and say, hey, I'm just new here. Our prescriptions are different from the UK. Let me know if there are any concerns. And that's it.
Yes, I think having that attitude of being a member of our team,
yes,
it just solves all the problems.
Exactly. So, this is not new to you. Despite all, Nova Scotia government, they have done a lot in terms of recruitment and retention. A lot has been done, but more still needs to be done.
Oh, yes.
And here in Nova Scotia, common issue is that there's shortage of family doctors. So from your perspective as a family doctor, what are the biggest contributors to the family doctor shortages?
That's a very big question. I think the first thing is, which has improved, initially was the licensing process.
Yes.
They've tried as much as possible. Of course, you got to keep patients safe, and the college and the government authorities, they have that responsibility. So it's how to sieve the ones who are trained for the safety of the public, which is great. And they've made a lot of adjustment over the last few years,
They've
which
actually streamlined the
yes,
process
which is
because
excellent.
yeah.
Which is excellent, and I give that to them, right? So and I project in another 5 years is probably not going to be the same like now, because the word is getting out,
Yes.
and more people are.
They're actively still recruiting.
Yes,
Yeah.
the feedback I'm getting from people around is that Nova Scotia appears to be quite attractive.
Yeah.
So I think help is on the way.
Help is on the way.
That's what I would say. I'm more of an optimist, right?
I can see that.
I think help
I
is
can
on the
see
way.
that. You know,
So,
it's like your
so
go lucky go. What's that
yeah,
phrase they use?
I'm more of a half full, not a
Yeah.
half empty
Good.
guy.
Good. So, what practical changes could help to improve access to primary care in Nova Scotia?
The major one, I think, and I don't know how it's going to work, is if there's a secondary care.
Yeah.
If there's a secondary care, a lot of family physicians, burdens will be off them. Which I think virtual always doing a good job in giving us that access. However, there's still that secondary third party thing where patients appreciate it, but for instance in the UK, if a patient comes in and I need to get a patient seen, all I need to do is to pick up the phone and call up the medical registrar on call. And it says, and I tell him this is my patient, and it's okay, I'll see him at the medical assessment unit, rather than the patient going to the emergency room. So that takes the load of the emergency room, and then the emergency physicians can face emergencies. The not so emergency but urgent care patients can go straight to the specialty because I've already assessed the patient for the ER doctor, so they don't have to wait 24 hours in the ER again.
Exactly.
So that's one thing that I think we need to work on.
Yeah.
I'm not sure how it's going to work, but I think if that is there, then we'll be on a good thing for everybody.
And what role do governments, institutions, and communities play in solving this challenge?
I'm not unaware that the government's resources, they're not infinite, right? And they have other things. And in the last few years, I know that they've spent a lot to bring doctors, to attract doctors and other health workers. I'm not unaware of that. And I think I think we will have to just look for advocates to help us present it more to them, to see the need for it. A lot of patients have asked me that why can't we talk to the government to reduce their waiting times for specialist reviews? And honestly, I tell them, look, getting a specialist in here, number one, is going to cost a lot. And number two, you got to create all the things and all the necessary support staff that they need, so that multiplies the need. So I think the main thing we need to do as physicians is to keep advocating for it.
Yes.
And hopefully the government will see the need for it. But again, over the last, I've been here now for I came here 2018, so this is about almost 7 years. It will be 8 years this year. I've seen progress. Yeah. I've seen progress. So we're not there yet, but I think we're not where we used to be. Yes, we're on the right path. So I think what they're doing to keep advocating, hopefully we'll get there. But we're not there yet.
I feel that they need more representation of family physicians at the table.
Yes.
In terms of healthcare resource allocation.
Yes.
Knowing how to prioritize.
Correct.
Just like how we triage.
Yes.
To look, this is what is of utmost importance compared to this money that you're spending here and all that.
Yes.
So I think having more family physician representative
on the table, yes.
And
I know that there were some family physicians who've taken some posts
in leadership
positions, but Let's see how
Let's
far
see.
it goes. But I think, honestly, we're not where we used to be.
For sure.
I can remember where we used to be. We're not there.
We're not there.
Yeah, so
I know a lot. I've seen a
hopefully,
lot of changes
yeah,
and a lot of movements. You know,
yes,
people, a lot of doctors coming in and
yes,
settling. So
yes,
more doctors are staying back compared to a couple that may
correct,
have, a
correct.
few that may have gone back, you
Then,
know. Yes.
correct.
Mm.
Yeah.
Okay. So you've clearly worked hard
Thank you.
to build your career, but beyond medicine,
Yes,
you are also a husband
yes,
and a father.
yes,
And sometimes life brings experiences
correct.
that shape us in ways we never expected.
Mm.
At what point did you begin to notice that something might be different in in your child's development?
Oh, yes. So thank you for that question. That's interesting. So my first son has a diagnosis of autism, and I'm I think right from his birth I knew. Of course, I'm a physician.
Mm-hmm.
But because my wife is not medical, I've got to be very, you know, I have to be very sensitive
That's the word.
to allow her to process it. So even though I knew I couldn't say it because she needed that.
At what point
I,
did you?
so
How old
I
was
knew
he?
about when he was about 2, 3 months. I started
Really?
seeing it. I started seeing the fact that he wasn't sleeping, he wasn't crying like you expect babies to cry. He wasn't. So I started noticing it. So, but I, I had to, and it's emotional period for women that just giving birth. So I had to support my wife. And at that time too, I just passed all my exams in the UK, and I was just starting off, on my career, because by the time I got to UK, I didn't start as a physician.
Mm-hmm.
I went through the ranks like everybody else.
Everybody else, yeah.
So every time when I see people come into Canada and complain, like, what are you complaining about? Go show yourself that you can do it. Don't say
We
no
all
one
did
no
that.
one no one is against you. No one is trying to stop you except you. So whatever laws they've put in, you have to find a way to prove that you're bigger than the law. You can obey the law, pass the exams, and go. So at that time, I
I mean,
would
go
just
through the due
go through the due
process.
process, no
Yeah.
doubt.
Mm-hmm.
Yeah, but pass the exams, and then show yourself that you deserve it, and then everyone will open the door for you.
Mm-hmm.
So, but I didn't want to disturb that, you know, process.
Dynamics,
So
yeah.
I had to let her grow into it. But I knew early enough. So I was supporting her, getting all the necessary help, and I had to be very sensitive so that I can break it into chunks so she gets it. So I think she got it. So the day she got the diagnosis,
Diagnosis. I was about to ask that. At what
I
age
was
was he?
so I think it was a lovely boy playing all over, I think he must be about the age of 2 or 3.
Mm-hmm.
He went to play, and then one of the occupational therapists and the speech and language therapists made some comment that why is he not, verbalizing things that like other children. I wasn't there, but I mean, this was a private because I had to make sure we pay for it so that she can, you know, and that she thinks we need to exclude autism. So, but she didn't take it lightly, my wife. So by the time she came home and she told me, I said, okay, it's okay, don't worry, let's go through the process, let's get it done. And then I started breaking it down slowly. I had to break it into pieces for her, just so she can digest it well. So I gave her a little bit, and I held up back the rest
Mm-hmm.
for the information to explore some interventions,
Yes.
and then gave a little bit, and then she explored more interventions. So gradually over time, so I think it must have probably taken a few years
Bless him.
before she could
Come to
come to
terms.
terms with it, right? It was a mix of emotions,
Of course.
right? But I had to support her because I had the privilege that I had seen I'd seen people who, because of my kind of job, who many in the public don't know they have things like this in their family.
Yeah.
Um, and
Especially in our
in our
underserved
in
community, in
our
our black
undeserved
community.
community,
Mm-hmm.
yes. Like I've had the privilege of even having someone who is, I mean, I'm not going to mention their name,
Mm-hmm.
But obviously, we're religious. A lot of the average person from Nigeria knows, and I've experienced the because I was close to the family, and I've experienced seeing, and most people don't know, they have a daughter who couldn't walk, and very almost one of the largest congregation in the world, and nobody knew. But I've seen the way these people process it,
Yeah.
and I've seen how happy. And I watched them at a very close distance, and because when I was I'd had the privilege of getting close to seeing how one takes to situations where they're not what you want, but you've got to just move on with it.
It is what it is.
Yes, and I don't know anybody who doesn't have something in their life that they wish wasn't there. I don't think there's anyone like that. It's called LIFE, life, you know. So
LIFE.
so yes. So I don't think so. It's basically how our approach is to it.
Exactly.
And I see them do their lives, live their lives, and nobody knows. Even when they lost this daughter of theirs that couldn't walk, most people don't even know.
No.
I saw the process. I could see them from the private and the public.
Yeah.
And I could see the glamour of how people mystified them. I mean, I respect them. I'm not saying that. And I could also see it in private. I'm like, okay, so just do the best you can.
do the best
Live your
you can.
life. Enjoy your life. And then help all the so it was easier for me over time. And I've seen patients, and I've seen the resilience of my patients. I've seen how they've taken a news, and I've seen how they've approached it. I've seen both sides, and I knew that you can actually stay on this other side and win, despite the situation.
And win together because you and your wife
oh
are a
yes,
team.
oh yes. So it was easier to then help lead, and now she's fine.
She's
very
fine.
good.
So still talking on the diagnosis. So obviously we talked about it a little bit. So you highlighted the fact that receiving the diagnosis was very emotional, and it
Yes.
was a complex moment
Yes.
for your family as well as other families that are having to deal with similar situation.
Yes.
But how did this experience affect your family dynamic and your marriage? You've already talked about it. So what I could gather is that both of you were sensitive to her progress.
Yes.
And her understanding
Yes.
of the condition.
Yes.
And you were also patient. You allowed her to process it at her own time and when she was ready.
Correct.
Which is a good positive factor,
Yeah.
especially in the kind of community that we
Yes.
come from.
Yes.
And it can impact a family negatively,
Yes.
especially on the woman more.
Yes.
What do you think?
Correct. That's true. I think stigma is more of ignorance than anything else. So if we knew better, we'll do better.
If we knew better,
Yeah,
we would do better.
Yeah, most people don't really understand it, and that's I had the privilege of discussing. I think a few weeks ago in a gathering, and I was talking about health, and I said one of the problems with our communities, people have a very wrong understanding of mental health issues, especially because who we see are those who have complicated issues with mental health, not those who've sought help, who've got intervention, and who are living as near normal lives as possible. So the picture of mental health in many people from our community is completely blurred.
Yes.
And that's how we need to bring, and that's why I must thank you for this opportunity for bringing that out so that people understand that mental health is just like any other medical condition.
Just like diabetes. People in our community, people will come out and say, "Oh, I have diabetes." But mental health,
yes, they just hide it.
Exactly.
And then you make the situation worse because then they don't seek help.
Yeah.
Mental health is even easier than a lot of physical condition. Interestingly, mental health, as long as you seek help early, timely intervention, then you're good. Right? It may not completely take it away, but it can be most of the time managed to appropriate level of near normal living as much as possible.
Exactly.
And that's the word that we need to bring out.
That's
You
the
know,
message we need to
so
spread. And you're talking about we are the community.
yes,
You are a physician.
yes,
What you're doing is advocating,
yes,
increasing awareness,
yes,
and hoping for understanding and acceptance.
yes, yes, yes,
We need
yes.
people like you out there.
Yeah, we've been doing as much as we
Advocate.
can. We're doing it.
So, do you feel your son currently has the resources and the support he needs for his well-being and development now?
Well, again, I think it does. But you know, in every situation like that, we have to look at the dynamics and the individuality, the uniqueness of the person.
Uniqueness.
Yes. And having spoken to a lot of my patients who have children with autism, I realize that most of the time we focus on what we don't have and we don't appreciate what we have.
Exactly.
Right? So there's no way anybody, any establishment can give you everything. Yeah. Right? So the little support we can get, we can either work to amplify it and make it work for us, or we complain about what we don't have. So as far as I know, I think he has all the support. I believe he's happy. We take him as our hide and seek game, where we're trying to understand what he wants. We're trying to get him, and every time he goes ahead of us, we take it as a mathematical equation that we need to solve. And every time we crack it, we laugh, and we move on to the next challenge. So that's how we've been living, and now it's fun. It's fun in the whole house. So that's the thing. So there are things we are not getting, but it's just like everything else.
Just like
and everybody. I think the greatest blessing, one of the greatest blessings is my wife, because she's got it now, and it's easier for us to discuss and laugh about it, and then creatively creatively find solutions. Where there is none. So because when we moved to Canada, in the UK, which is one of why I have a friend who was going to move to Nova Scotia, and they had to go to Ontario. He's a family physician. His son has autism, and he was asking, what facilities are available? Do they have school for children? In the UK, there's school where people, they have a system. They come pick him up in school, go to the school, dedicated for them. Canada has a different system. I said, no, it's a bit different here in Nova Scotia. They go to the normal mainstream school. They have their own learning center. I'm like, oh, I didn't like it. But so the first time when we came in early, it was a bit of a challenge for us. But now looking back, it's like, I think I get the idea. The idea is get even the children in other who are differently able from the child who has autism to see that everyone is unique.
Integrate them,
and thank you. That's the word. So we've just flowed along that line.
Beyond the personal journey, there is also the need or the question of advocacy, ensuring families have the support they need. In our community where awareness may still be limited, how can we better support families?
This is one of the things you're doing. Well done, thank you. Bringing awareness. I think, again, if we know better, we'll do better. We have to let people know that this is happening. This is what it entails. Like, for instance, I have a patient who is from our community. The son has autism. The son is not my patient. She came and she was just crying and crying and crying. Why? Because the son had, irritability and all those things, and they had told her that the son needs to start medication. She doesn't want to. And it's just because she didn't know that these things are there to help your son. And then because the son wasn't taking medications to help, so I had to sit her down. Say, look, the son is not my patient, but let me sit you down. Let me explain to you. Imagine you being in a room and you've got trucks blaring their horn. How would you feel? Just imagine that. And so your son just put your son in that kind of picture. Assuming he's in a room and the people are blaring, how is he going to behave? He's looking at you not because he intends to misbehave, but that's the way he's interpreting the messages he's getting. You know, and then he sort of understood that, okay, this is what they've been trying to get. So it's like, you know, we need to bring the message out. And historically, people from our community tend to, you know, trust us from the same community more because they feel we have the same shared experience. So I think people like us who have the privilege of knowing about this condition, or who have the honor or the privilege of having a personal relationship like someone like me, lived experience,
like me, like my dad, dementia as well.
I think we have to then be more vocal.
That's why we need to share our story.
Yes, that's why I'm thanking you for this opportunity to bring the message out.
Exactly.
So that people can know.
So you've kind of hinted that in terms of, well, how has this shaped you as a person and as a doctor in caring for your patients, especially the ones with, you know, with autism?
I'm not sure anybody can be a good doctor without being a very compassionate person, first and foremost. As a person, you've got to be human first. Understand that you're not dealing with conditions, you're dealing with someone like you, someone that has feelings, who is not just a number, who has emotions, who has dreams, who has aspirations. And so that's the starting point. And when I started family medicine training, the first thing my trainer told me, he said, Lani, just be human and you'll be a good doctor. And I said, yes, Chris, I believe that's true. You know, just be human. You know, just be human. You know, I mentioned about that, my patient. Our son was not my patient. She came and she was all, I said, can I see your son? And she was glad enough to bring him. He's from our community. This is the boy that everybody says is not listening. He was calm with me. Maybe because he saw me where we share the same kind of color. He was calm with me. He spoke with me. He said, yes, I'm going to take medication. We had a very beautiful conversation. You can almost believe he had nothing going wrong, you know, just because he could identify, and I could identify with, you know, the way
how to communicate
with him
in the manner that he
like the way you said when your dad had, and then you just put on his favorite music, and you could get him to calm down. When nobody could reach him, you could reach him.
I could reach him through music. Yes.
Same thing. Same thing.
So has this changed your parenting style? Like, you mentioned before that for any challenge, you find creative solutions until another one, another bomb.
Yes.
But in terms of your parenting style, has that changed you in any way as a father?
I would say it changed me. I would say it taught me.
It taught you.
It taught me to be a father.
Yes.
And you know, a father is someone, or a parent is someone that understands that every child is different and unique. And you've got to work with them. You know, like my daughter will tell me, Dad, why do people think it's difficult to cook? And I'm like, really? I'm saying this is not just you don't know that for some people just getting that, you know, that's the only thing basically we don't struggle to tell her to do. You know, she's getting to be a teenager now. Every other thing is a fight. Is to get her. But if you want to get her, just say, can you please help me make some steaks? You don't have to struggle. She just, so.
Her mom is a chef.
Yes, so that's her style. That's her unique person. So for my son, we have to discover him too. And that's what the position we take. So it's fun. So what's supposed to make us possibly get frustrated, we take it as a challenge. Okay, that's the next card. Let's explore this. What do we do next? How do we overcome this? How do we come to terms with what he wants? How do we get into? So it's taught us to be good parents, you know, and being able to walk with them and go in their shoes and try to decode their language
Exactly.
and speak their language back to
Speak the
them.
language.
That's it. It's a learning experience for us. So because we have that attitude, we don't get lost when something new comes up. So it's been interesting. Honestly,
Good.
we don't see that challenge anymore.
And how can parents better navigate and access services or important resources, but for themselves and their children?
I think family physicians play a very important role in that. It's we play a very strong advocacy role to help our patients,
Yeah.
and we're uniquely positioned to do that. It's a big privilege, and I will basically first ask such to, speak with their family doctors. And for people from the Black community, there's this nice Black brotherhood where they allow you can come and express yourself.
Sisterhood,
Government
yeah.
knows that. As sisterhood, okay, that's good. And government knows that, so they allowed that so that you can get help and we can get help that we need. That's the first calling point to access those. And also, I think as physicians, we should actively educate such families on what this condition is all about. Any mental health, especially, because there's paucity of knowledge about it. And that's why I appreciate what Prince Harry is doing. He's going all out, trying to get people to understand that mental health is real. There's PTSD, there's other things, and it's trying to create ways that people can have fun with it.
With the Paralympics.
Paralympics, that is does.
What's the name now? I forgot. Invicta Games.
Invicta Games, and that's great. That's wonderful. So that's the whole thing, is just to get people to see that in spite of the challenge, that it looks like there's something good about it that you can explore, and just look for it. It's a game. Just search for it and work with it. It's interesting.
So as you know, with Autism Nova Scotia, they support families and the individual with autism, helping them with awareness and understanding the condition and the resources out there.
Available.
I found out that Inclusion Nova Scotia is a club. It's like not like daycare club, but it's a club that they help with socialization, like to create fun activities, like a center where they can be dropped off and they can access resources. It could be sports, it could be anything, it could be crafts, whatever. So that's a good. And then Prescott, they actually help with supporting or providing employment opportunities and skills development. Like what you said was that you sort of focusing on what they don't have, but what you have. So they're trying to optimize the skills of the individuals with autism so that it will help them to be more inclusive in the society. So what can they do? They would do like occupational therapy assessment. What can they do? And based on that outcome, they would know how to direct them, place them, and some of them work as cashier. They provide them with work opportunities
to do.
Opportunities and support. So I wouldn't have known this if not of my role, and that has really enriched me, empowered me, and to better advocate and support these families, unique families with their challenges.
Well done. That's excellent.
Thank you to Dal. Okay, just before we go on the break, I want to first of all acknowledge and thank FT Dishes Restaurant for their generous catering support in the provision of hospitality for the cast and crew of Talk with Dr. Agnes show, and we'll be right back. Welcome back. So, Dr. Kusoi, let's talk about stigma here.
Yeah.
So one of the biggest barriers families often face is stigma. And this is what I've observed, especially in our community, as a result of generational beliefs. And when we don't understand or the cause of something, for example, dementia or any health condition like autism and all that, when it's uncommon or unnatural, we tend to attribute it to spiritual causes. And I wanted us to, shine a light on stigma here in terms of how can we um, empower people, because people, we are products of our environment,
Correct.
you know, and so that when things are, like I said, unnatural or uncommon, it's always like there's witchcraft, there's this, there's that, that family is cursed, don't say it outside. And this is kind of creating barriers for families to come forward to seek help, timely intervention, education, knowledge. And that's why I'm so humbled that you're here today to
Thank
shine
you.
this light and, you know, raise awareness about autism. So, have you observed stigma surrounding autism within communities or health systems?
Thank you for that question. That's a big one for autism and generally mental health. Um, yes, there's a lot of stigma, no doubt about it. But the origin of stigma is usually ignorance, right? Or the wrong information out there.
Misinformation, lack of information.
Correct. So, the way to, dispel wrong information is to give good, accurate, and professional information. So we have to be louder.
Louder, amplify our
Yes.
voices.
We
and
have to
increase
and
representation.
Correct.
When people see
Yes.
themselves in us,
Correct.
they are more likely to engage.
Correct.
And
Yes.
because they believe we understand
Correct.
where
they're coming from.
Exactly.
I mean, look at you sort of brought out dementia. I came for the program with about 5 people, and I was amazed how much people did not know about dementia.
Yeah.
People asking me questions, who is like that? I didn't show up. I was like, oh, really? So people really don't know. So it's really that people don't know, and it's the same thing. People are genuine. Most people, they're genuinely and sincerely ignorant and wrong, right? So I think the responsibility is on people like us who have the knowledge to shine it, which is what you're doing, and to be as loud as we can, to go on advocacy trips and to make sure that this knowledge is out there. I mean, imagine how I remember when this HIV thing came out, and people were very afraid to talk about it. And this guy came out,
Magic Johnson.
Magic Johnson. You know, there was something he brought to the scene, and then people started showing up. Now it's almost as if HIV, so what? You know, of course, there are now treatments and the rest of them. It's the same thing. So many times when we don't understand something and we are mentally lazy, we mystify it, and we then attribute it to something out of the ordinary, so that we don't investigate it again. You know, so we that have knowledge have a responsibility to shine it, and keep pumping it, because someone has said the wrong thing. We need to keep saying the right thing.
That generational beliefs
over time, until we all get it. You know, mental health. There was this story, I don't know, which I shared about this guy who had a mental health problem, you know, and because, you know, there's this generational belief that mental health is spiritual and everything, he didn't seek help. He had anxiety and depression, right? So he went to his pastor of his church and said he was going on a long trip. And the pastor he didn't know, he didn't understand what a long trip means. Right? He was planning to commit suicide.
Oh dear.
Unfortunately, he did.
He was successful.
He did.
He passed away.
He passed away.
Oh my God.
So what if only someone had the knowledge to spot this and get him to seek help when he's supposed to seek help? You know, and those are complications of mental health issues based on the wrong. So wrong information is dangerous.
Yes.
So we have the responsibility of shining it out, the right information, and not to stop until it's all over the place.
Yes.
I think that's where that's our responsibility, and that's what we need to take on.
For sure.
And thank you for bringing this out.
Okay. So I love this part. This is a part where we talk about, you know, adding on to what we were talking about previously, myths versus facts.
Okay.
So, Dr. Gusare, one of the challenges, like we said, families face is misinformation. There are many myths about autism that can create confusion or even stigma.
Yes,
I would love for us to address a few of them.
correct.
So, the first one is one myth many people have heard is that vaccines cause autism. What does the evidence actually show?
Well, I mean, people have said that, but we all know that the reason why they want to associate it is because it's around
The
that
MMR, yeah,
age
the age, yeah.
that's, autism is noticed
Yeah.
by the general public. Most, if you are more observant, you will have noticed it earlier.
Mm-hmm.
So for a while it took me time to convince my wife too that that's not true, because I had noticed it earlier because I'm
You said that
trained.
2 to 3 months,
Yes,
so yeah.
that's not when it gets MMR.
Mm-hmm.
But usually when the child is supposed to now have developed enough social skills around the 1, 2, 3 year old is when people notice it. And that's around the time they get the MMR vaccine.
Exactly, but that's what I'm about.
So,
Around that
so,
time they get the MMR
so
vaccine.
everybody's saying no, it's been demystified. And that's not true. Everybody knows that. They've done research upon
Lots of
research,
research,
and
yeah.
there's no association with it.
With
You know, all everyone needs to know is to have a very high index of suspicion,
yes.
and you catch it earlier than that time.
Than that time.
There's no research to support that.
Yeah.
No.
Thank you for that. And another myth is that only boys have autism. Can you explain why girls are often diagnosed later?
Late. You see, boys are, they're different, right? So you expect, so many times a girl might be a bit more reserved
Yeah.
than
And
boys.
they say that girls are moody.
Yes.
Or they're shy.
Yes, and you see, boys are expected to be the ones when they're still very young to be jumping all over the place
Exactly.
and to be relating. So that tends to make people feel when they can notice the boy more and earlier than girls. There are other things that can come up, but it's not true. There's equal presentation in both boys and girls.
And some people still believe autism is caused by bad parenting or parenting style.
Yeah.
Can you help clarify what science tells us about the actual causes of autism?
So research is still ongoing about autism, just as it's ongoing with so many other mental health conditions. The difference is just the fact that there's a lot of behavioral significance with autism.
Yes.
That you wouldn't expect at that age for the children or for the world. So, and then at that age, it is when you should be, the child will be leaning on the parent to know what to do. But with autism, because the child is processing information in a bit different way.
Yes.
So that's why I'm saying that sometimes it can be a bit of challenge to the parent.
Yeah.
They do all they can do, they give all the support they can, but yet they're not getting the result that they think they should get. So it has nothing to do with the parent. The best of parents are good parents at most times, but it's just the fact that when you are training your child and the child is developing, a child learns a lot by observation, right? Which in a child who has autism is not well developed to interpret it appropriately. So what you're meaning to explain to a child with autism that is wrong, he thinks is fun.
Yeah.
And in the integrity of their heart, they are sincere. So he's making noise, he's jumping, he's hitting this, he thinks it's fun, right? So it is us as parents who understand that, and we then have to look at what's the best way to approach this child.
Yes.
And sometimes the best way to approach this child are not knowledge that you can easily get.
Yes.
They can be very challenging, right? So if we find a parent who has a child with autism, the least we can do is at least to be compassionate with them. That
empathy.
I can tell you they've done a lot. They've tried their best, And because most times when when a parent has a child, they have dreams for that
Mm-hmm.
child. They're seeing the child in the future. They're not seeing him or her at the 1 year old. They're seeing him in the future becoming what they want them to be. And then it's not looking like kids.
Mm-hmm.
So one of the first people you need to give therapy to is either the mom or the dad or the parents who may not understand it properly.
Yeah.
Now coming to hear that they have been bad parents again, you sort of
That's
you-
very
that's
demoralizing.
demoralizing for them. So I think also again it's information,
Yeah.
and then letting the people know that they've done their best.
They've done their best. And they're doing their best.
And they're doing their best, and encourage them, give them the kudos, ask them how you can help,
Yeah.
rather than
Be judgmental.
be judgmental. Yeah, that goes a long way.
Another myth suggests that people with autism don't feel empathy or emotion. From your understanding and experience, how accurate is that perception?
That also is wrong. So the outlook and their own position and how they respond to things are different.
Yeah.
They are different. I've observed it, and I've at close range. They're different. They might delay emotional response, but they do respond emotionally. Like I've seen issues where sometimes someone comes to the house and it's not been there for a while, and my son doesn't know why this person is not there again, and then he goes to the room and like, where's this person? But while the person was there, he might
not have
it might not even be as if he notices it, right? So and by the time, like for instance, if grandma comes around from Nigeria, he may not even go to her room, but the moment she leaves, you see him go to the room. I'm like, what's going on?
He's looking for her.
He's looking for her. So the way they express, and all we need to know is to understand, come into their world, right? Look at the way they process information, and then it will be easier to deal with them,
Easier to
connect with them. Thank you, that's the word. And it is that key of connecting with them that's where we're trying to get.
Like they say in Nigeria,
Yes.
that's where the cocoa
That's
is.
where the cocoa is. Thank you. So it's the connection that we're trying to get. Yeah. Yeah. What's their number?
Some people assume everyone with autism has exceptional genius or abilities. How accurate is that portrayal of autism spectrum?
I am not completely sure, but what I've also observed is they're exceptionally good in some areas.
Because they're hyper-focused, or
Yes.
some are hyper-focused,
Yes.
some are under-focused.
Yes.
Yeah.
They're exceptionally good in some areas, and it's different from different people. Some of them have music as what they are good at.
Animals.
Some have animals. Some have. When my son was younger, if you give him the iPad and you clear everything away from the iPad, there's one video he will watch. He will bring it out on the internet.
Wow.
How he does it, we
Nobody
don't know. You just close everything give him back the iPad, open it for him. The next thing you're gonna see that video.
Because he's hyper-focused.
Because he knows where he wants to. So we just noticed that. While he was like 3 or 4, his mom will put social media, give him her phone, and hide all the social media platform, Facebook, Instagram, all those. She'll hide it in one corner of her phone, hoping that let him just have fun. By the time she's turning, he's posting his picture on his mom's Facebook.
Wow.
And our friends are calling her, your son is really nice, he's looking beautiful. I say, what happened? So that's the thing. So they are extremely good in some areas. We just have not discovered them enough. So, but I don't know how wide that is. But from my observation, that to a large extent is true.
It's true.
Yeah.
Good. There's also a perception that autism is a new condition or even an epidemic. What explains the increase in diagnosis that we see today?
I think we're more aware of it.
Awareness.
It's like ADHD. There are a lot of parents who are coming to get diagnosed because their children were diagnosed. And actually, this happened to me when I was young, and I struggled along. So it's
Especially
more
with ADHD.
That's what I'm saying. ADHD. That's what I'm saying. So a lot of parents come back and say, hey, doctor, my son is on this medication. This is how I was when I was younger. But I managed to escape school, through a lot of struggles. But this is getting better now. Can I be
tested?
kind of tested? So I think the awareness is better now. So that's why it looks like it's common now. But I think it's always been there.
Always been there.
Yeah, it's always been there.
Another misunderstanding is the belief that autism can be cured.
Yeah.
How should we think about autism from a developmental and supportive perspective?
I think the best approach is supportive and work with such. I don't know of any research that's attests to that fact. It's a neurodevelopmental condition, and the outlook of it's like saying someone's personality can be cured. But I know research is going on how best to integrate and make such children live as normal life as possible. But I am not aware, out of my own limited knowledge as a family physician, of any curative measures, for this. I know people have posted a lot of things on the internet, trying like stem cell therapy. They're spending so much money on that. I'm not sure how effective these things are. Right, so I'm not aware of it.
Some people think individuals with autism do not want to socialize or form friendships. What is the reality for many individuals on the spectrum?
Yeah, I think that's a little bit. It's understandable that they sometimes can behave differently, but I can tell you they really want the association. One of the privileges we have is that my son he has siblings who are not on the spectrum, and it protects them. You can see that he wants to relate, and you can see that, for instance, I don't know how he does it. When the younger brother was doing, if he noticed someone wants to, how fast he is to save, like one of the time his brother was about to fall from a table, the way he jumped and held him so that he doesn't fall.
Wow.
He was wow. So you can see that, and he loves the company of his siblings, and maybe because he feels that they understand him. So I think what is needed is people to be a bit more sensitive and just understand them. They're beautiful children. They're lovely. They just crave understanding.
They crave understanding.
And then we just need to come into their world and understand how they process information differently from us. And once we can, as we said, connect with them, it becomes easier. And we are more, and they're sincere. They're just, that's where I can put it. They want to socialize, but the expression might be a bit different from us, from the average person. We just need to understand and allow them to be within the safety of their capabilities. That's what I would say.
Thank you. Coming up next, we'll be taking questions from the audience, and we want to thank FC Dishes Restaurant for generously providing hospitality for the cast and crew of Talk with Dr. Agnes, and we'll be right back. Do we have any questions?
Thank you. Good evening, everyone. My name is Omolara Ajimansi, and I just want to say a big thank you to Dr. Agnes for having this particular topic today, and for Dr. Olani for sharing his personal experience as well as his professional outlook on things. I'm a mom that has a son that has a diagnosis, my very first son, and but in my own case, I was the first person to notice something was wrong. And every other person said, you're overthinking it. It's just so growing, we are growing. Even my husband, it took him a while for him to come to terms. So I had to, back home then in Nigeria, I had to do a lot of reading on my own, researching. Even every time we go to the doctor's office for either checkup or any, whatever it is I take the child to the doctor for, I always, share my concerns. And even doctors, they don't kind of believe me, and I'm like, something is not right. And I think it was when he was about 3 years old or 2 years plus, and that was because it was from the school. The school raised it as a concern. I'm like, yes, I know something is not right, but I've been asking questions, talking to people, but no one seems to know what's going on. And that was when the journey started. So I had to do a lot of self-education for myself because it looked like I was just all alone. And then we're in Lagos, Nigeria, and then we relocated to Abuja, and the school did call me one day and say, we are sorry, we can't keep your son in our school. We don't have the resources to teach him. And I'm like, where do I take him to? Where do you go to? And they recommended the school to me that was way out of budget. Like, even if we combine our incomes together, we couldn't afford the school fees. And that was when the headmistress connected me to a lady in Abuja then that would train in Ireland, but she came back to Abuja to set up special needs for private schools, and she was the one that, broke everything down to me, and she said I shouldn't worry. She, got a teacher for my son, so he had his own teacher going into his school to teach Justin, but he needed to be in the school so that he can associate with other kids. And that was the journey. And we got her diagnosed when we came to Canada, and then he was already 6 years old.
So do you have access to the resources?
Yes, we do. We're kind enough to, get a family doctor that really understood, advocated for us. We were able to get into the IWK, and we already have a doctor that sees him. And just like everything you were talking about, Dr. Laniyi, the experiences I lived through. And as he's growing, he's losing, he's getting better and better by the day. Like you said, that we celebrate, we are looking for things that are not there and forget about the things that are there. And that things really stuck with me, because there are so many things he has that, because you're kind of watching for the big things, you don't notice. And there are some things that he's really good at. And like you said, they are very, very loving kids. And my only question is, this question is for me as a parent, and probably Dr. Laniyi, maybe you might have something to share with me. Do you have concerns about what the future would hold? Because, as parents, one of the things we try to do is to help our kids to become independent, so that we wouldn't be alive forever. We expect our children will outlive us. My concern as a mom with a child with autism is that, yes, I'm alive now. We are doing fine. I'm available most of the time. What happens when I'm no longer there?
Thank you for that. And thank you for being open enough and being vulnerable enough to tell us your own story in that little way. Thank you very much. Yeah. Honestly, it takes strength to be vulnerable, right? And we must acknowledge that. Right, about the future. Okay, there was a time diabetes was a death sentence. Just having diabetes until insulin was discovered. So what I'm saying is, of course, one can think about the future for such children and anticipate a future where they will really struggle, that they can't be like other children. But the world is moving at a very fast pace now. In fact, some people are saying that work might be a bit irrelevant in the future with the advent of AI, right? And things are being developed every single day. While we can plan for the future, I think we should just enjoy the day as it comes. That's been our approach, right? And celebrate the little gains, the little wins every single day, right? And because there's so many things we can think about the future, and we're going to be worried, not just for that, for every other thing, right? And there's a measure of worry that is good. Okay, it gets to a point where it may not be too healthy to dwell on it. So my approach has always been plan for the future, do what you can in such a way that if for any reason things doesn't improve regarding research, regarding being able to cope independently, the things are there in place. And of course, the government is very kind, living in such an environment like this, where they have, there's so many government system to protect such individual. However, I am more optimistic about the future more than ever before based on technology. There's so many things coming out every single day that the future might actually be brighter than we think. That's my own approach.
I think I'm just going to add to that and say, yeah, as a parent, even I have uh, I have 3 kids, and I'm always worrying about their future. That's what we do as mom. We want the best for our children, and so I understand where you're coming from, especially with your child with unique abilities. So what I would say, add to what Dr. Ogunsanya said, is be part of groups like I mentioned, for example, Prescott. I know that that they are there to develop, help to maximize the skills that they have, skills development, and also they help with employment opportunities, so that they can be, so it makes it easier for them to integrate in the community. The new there's this oh god, the remedy. I think it was a litigation or legal process that happened about human rights for individuals with intellectual developmental disability. So what they're trying to do going forward is for them, instead of before they used to relegate them, put them in institutions and what have you, and they couldn't maximize their skills because they were mostly locked away because of their disability. But the new thing, what we're trying to do is for empower them to live in the community like everyone, like an inclusive community, inclusive society, therefore protecting their rights to live in the community just as everybody else. So what such organizations do is to help to, in terms of skills development and opportunities that they will be able to they are good at, and they'll be able to function to the best of their ability in the community. So that's the future going forward. So I would, although it's for adults, I think, but for now, your child is still with IWK. But we at the IDD clinic, we take referrals from children from 17 years and above. So at some point when your child gets to the age of 17 and above, you can ask your family doctor to refer to the Intellectual Developmental Disability Clinic at Dalhousie. And this is where we can help with resource navigation and give empowering you with how you can best support your child and how your child can best function well in the community based on their ability. Does that?
Thank you. Thank you. That's good.
Oh, sure.
Hello, everyone.
Hi.
I'm Dr. Macaulay Okoro, and I'm also an early childhood educator. And thank you so much for this platform. It's amazing, Dr. Agnes.
Thank you.
And our discussion so far resonates with my career, working with children. I'm in the pre-primary for the public schools. So you see children on spectrum, we see unusual behaviors, we refer, and of course some come with diagnosis and we can support. So my own observation over the years is those children love processed foods. I may be wrong. They love processed food. Candy, sweets, and of course it triggers anxiety and all those things. But I came across a video recently and the lady said, she's a mother, she's not a medical doctor, but she said she cured her child of autism with freshly made food, natural food. Is that right? Like, is that a correct myth, or is it actually, if it is true, is there a way that you can recommend food to even supplement the medications and the guidance from the medical perspective? Thank you.
Thank you so much for the
Thank
question.
Oh, well, thank you for that. That's a good question. I've been asked that many times, and I did my own research. I looked into it. I looked at all the journals. Um, the general conclusion is that there are some association with gastrointestinal, just like any other person, right? Um, with the guts, people with IBS. And I always tell my patients, the bowels, they are as unique as your fingerprints. What works for someone might not work for the other person. Um, Generally, usually most children will like anything that is sweet. That's like candy, they'll go for it. Put my son in a room full of candy, he'll just be at home there. So, and we also notice once there's so much sugary stuff, they get the energy to do things and they want to just go over the edge. I'm not sure that thing about food therapy to cure autism is accurate. I'm not
to
sure.
integrate the word cure into
Yes, but certainly it can help behavior.
Oh, absolutely.
Especially if, like, someone with IBS, right, irritable bowel syndrome, who's taking a particular kind of food and it irritates the bowels, they're not going to be happy. They're going to be behaving differently, especially if it's a child. And then someone who is on the spectrum, who then is not being irritated with those exposed chemicals again, so it could be that the behavior the child was exhibiting that looked extreme was in reaction to the way they were feeling with what was going on in the food, but I don't have I've not seen any research that says that cures it. It will help with the behavior, no doubt, especially if the child is sensitive to it. But I'm not sure that's completely, that has a scientific backing or presentation with it.
I think what I will add to that is you can never go wrong with by giving your children choosing healthier food choices, especially the more the processed food is absent from their diet. It will definitely help with behavioral management, which we find with children that have autism. So from that angle, definitely the symptoms would significantly improve if that mom significantly eliminated processed food from the diet. At least that's the angle I'll look at it from. So in general, I would say if one can afford it to the best of their ability to choose healthier food choices for everything, even apart from autism or chronic health, just for their general well-being and growth, the healthier food choices, fruit and vegetable, less sugar, less salt, less oil in general, I believe that will always be in the best interest for that child going forward. That's all I can say.
Thank you for having me. Thank you.
Conversations like this help bring understanding, compassion, and awareness. Also, they remind us that behind every diagnosis is a family, a story, and a community. Before we go, let's remember this. Your story matters. If this conversation touched you, taught you, or stayed with you, please share it. Join us on YouTube and follow Talk with Dr. Agnes on social media for more conversations that bring health, humanity, and lived experience to the forefront. Rooted in story, rising together. My name is Dr. Agnes Chinelo, and this is Talk with Dr. Agnes. Until next time, take care of your health, your purpose, and each other. See you soon.